Dr. Smith, physical therapist here, and today I'm going to be talking about home care emergencies. Now, as a home care physical therapist or clinician, you're going to be walking into a variety of situations and scenarios, some which may be emergencies. Now, if you've seen my stroke video or my cauda equina video, you've seen what to do in those situations. However, I will recap it in this video. So, most importantly, if you're walking into a patient's home and you suspect a stroke, make sure you call 911 immediately. We all know that ischemic strokes do better if they get TPA within that 4-hour window. And to refer to stroke signs and symptoms, you can check out the FAST video I posted previously. Now for cauda equina syndrome, I've only found it once, and I actually ended up being correct on my findings, but I did not call the ambulance for that. I had the patient's husband take her to the ER. And in those situations, just because they have a loss of bowel and bladder does not mean it's cauda equina syndrome. Use your clinical judgment, because sometimes it could just be something else going on and you don't know unless you have a CT scan and so on. But I would say usually if you have positive upper motor neuron signs, you have a history of a back injury or spinal cord compression and the loss of the bowel and bladder, that's when I would highly refer to the highly suspect cauda equina and refer to the ER, because those are some more clinical signs putting together the picture. Now, a more common situation, and actually one that I arrived to today, is sometimes you arrive at a patient's home, there's no answer to the door, you don't know what's going on. Sometimes they're responsive, sometimes they're not. You always want to check the door. Hopefully it's unlocked to make sure they're okay. And what I found this morning was a patient had fallen last night and was actually on the floor for over 12 hours because they were not strong enough to get themselves back up. And unfortunately, they just got out of a rehab facility and they were probably discharged too early as they fell and weren't able to get back up. But they were also in severe pain. So because you don't want to break anything, especially with a neck injury, a back injury, a hip injury, what you want to do in this situation is, well, first of all, let me rephrase it. If you find them and they're not responsive, make sure you check for airway, breathing, circulation, check the pulse and so on. And then if they are unresponsive, attempt CPR, compressions only. If you don't have a barrier, and call 911 immediately. Now, if they are awake and they aren't in severe pain and they feel okay and you feel okay, then you can try to help them back up. But most of the time, if they've fallen, they can't get up, and they do have some severe pain that's caused them to lay on the floor all night besides general weakness, this is when you want to call the non-emergency line and request fire rescue. Now, fire rescue is going to come out and assess the situation, but they're going to know the positioning better for these fractures and so on. And yes, you can do that as a therapist, but just to save yourself in case there's a hip fracture, a back fracture, maybe something happened in the neck or so on, you don't know how bad the fall was, especially if there might be an open wound, it's just better to call fire rescue to just get them back up. And sometimes they need to go to the hospital due to the severe pain or a fracture. And you always hear all the time that people fell and broke their hip, or broke their hip and then fell. You know, it's what came first. But in these situations where you're finding patients that have fallen and can't get back up, I would highly recommend calling fire rescue's non-emergency line just to have them come out and assess the patient. And sometimes they do need to go back to the hospital. Now, again, sometimes you're going to find patients that are asleep and so on, but just make sure that you're using your best clinical judgment. Don't do anything that's going to jeopardize your patient's safety or your license. So hopefully this video has helped you with emergency situations. If you have any questions, comment below, and thank you for watching.